Ever get that feeling of tightness in your chest? Or maybe you find yourself wheezing, or you're just dealing with a cough that will not quit. These things are incredibly common, but they can also be a sign that something more is going on, and it needs a closer look.
So symptoms like these could be pointing to two pretty common lung conditions: asthma or chronic obstructive pulmonary disease, which pretty much everyone just calls COPD. Now, while they can feel really similar, they are fundamentally different. And getting the right diagnosis, that is absolutely crucial for managing it properly. So let's dive in and break down exactly how to tell them apart. Let's think of this as a tale of two very different lung conditions. Yeah, they might share some of the same symptoms, but their stories, how they start, what sets them off, and how they progress over time are completely different. We're going to start with the basics of each. Okay, first up, asthma. You're probably familiar with the classic signs, right? The wheezing, the breathlessness, that tightness in your chest, and coughing. But what really defines asthma is that the symptoms are often episodic, meaning they come and go. They're usually set off by very specific triggers, and they can feel a whole lot worse at night or first thing in the morning.
Now let's talk about COPD. This is a condition that's usually on the radar for folks over 35, especially if they have risk factors like a history of smoking. The key difference from asthma, and this is a big one, is that the symptoms of COPD are persistent, and they tend to get gradually worse over time. This means a constant feeling of breathlessness, a chronic cough, and often producing mucus every single day.
So what do these conditions actually feel like on a day-to-day basis? Really understanding the symptoms and what triggers them is the key to telling them apart. So let's put them side by side and you'll see the contrast pretty clearly. This really shows the different patterns perfectly. Think of asthma, over on the left, as being kind of like a volatile siege on your airways. It flares up and then it settles back down. COPD, on the other hand, is more like a slow, steady erosion. It's a persistent breathlessness that gets worse when you're active, and it's usually accompanied by a constant cough and often a lot of chest infections. With asthma, it really is all about the triggers. An attack can be sparked by almost anything, from exercise and allergens like pollen to just a simple blast of cold air. Even certain medications, or especially in kids, a strong emotional reaction like a big fit of laughter can be enough to set off symptoms.
Now for COPD, the focus shifts completely to long-term risk factors. Age is a big one. It's pretty rare in people under 35. But the single biggest factor, by far, is a history of smoking. Being exposed to dust and fumes for a long time at work or in your environment also seriously increases the risk.
So if the symptoms can overlap so much, how do doctors figure out what's really going on? Well, this is where the diagnostic detective work begins. They use very specific tests to look for clues deep inside the lungs.
And believe me, getting this diagnosis right is absolutely critical. If you mistake one for the other, it can lead to a treatment plan that just doesn't work. That's why doctors rely on these objective tests to confirm what's happening and make sure they get the management right from day one.
So a key diagnostic clue for asthma is this idea of reversibility. To check for this, a doctor might have you breathe into a device, then take a puff from a reliever inhaler, that's a medicine that helps relax the airways, and then test you again. If there's a big improvement, it shows that the airway narrowing is temporary and can be reversed, which is a classic hallmark of asthma.
Now for COPD, the gold standard test is called spirometry. It's a simple test that measures how much air you can breathe out and how fast you can do it. The key finding in COPD is a persistent airflow obstruction that doesn't really get better even after using an inhaler. This confirms the airway narrowing is fixed and not reversible. And this chart shows you exactly what that spirometry test reveals. It's looking at a specific ratio, basically the percentage of your total lung capacity you can forcefully breathe out in just 1 second. As you can see, healthy lungs can push out about 80%, but with COPD, that number drops below 70%, which is a clear, objective sign that there's an obstruction.
Okay, so once the diagnosis is confirmed, the focus shifts to creating a personalized treatment plan. The approaches for asthma and COPD are very different and really tailored to the condition, so let's see how they're built. For adults with asthma, treatment usually follows what's called a step-up approach. It often starts with a single combination inhaler, one that has both a quick-acting reliever and a long-term anti-inflammatory preventer, and you just use it when symptoms pop up. If things are still uncontrolled, the plan steps up to using that same inhaler on a regular basis, then maybe to a higher dose, and if that's still not enough, it's time to see a specialist for more advanced options.
COPD treatment is tailored to the person, based on their symptoms and their risk of having flare-ups. So, someone at low risk might just start with a single long-acting inhaler to help open up their airways. But someone with more severe symptoms or a high risk of flare-ups will likely start on a stronger combination of inhalers designed to provide long-term airway relaxation and control inflammation.
You know, the common thread here, regardless of the diagnosis, is that managing either of these conditions effectively really comes down to a personalized action plan. You can think of it like your own personal roadmap. It helps you recognize when your symptoms are getting worse and tells you the exact steps you need to take. It's all about empowering you to stay in control of your breathing.
Okay, now this next part is incredibly important. While cough and breathlessness can absolutely be asthma or COPD, sometimes they can be a sign of something much more serious. We need to talk about the red flags that require immediate attention.
If you or anyone you know is experiencing any of these symptoms, this is not the time to wait and see. Coughing up blood, losing a lot of weight without trying, having persistent fevers, chest pain, or a cough that just won't go away after several weeks, these are all urgent signs that mean you need to see a doctor right away.
These red flag symptoms will immediately prompt a doctor to order an urgent investigation, usually starting with a chest x-ray. The whole goal is to quickly rule out serious conditions like tuberculosis or lung cancer, just to make sure nothing is being missed.
So let's bring it all together with one last clear snapshot. Asthma often starts in childhood, has symptoms that come and go and are tied to specific triggers, and its key diagnostic feature is that reversibility. On the flip side, COPD typically starts later in life, is progressive, is strongly linked to smoking, and is defined by that persistent, irreversible obstruction. Ultimately, your symptoms are telling a story about what's happening inside your lungs. Listening to that story and working with a doctor to get the right diagnosis isn't just about getting a label. It's the absolute first and most critical step toward finding the right plan, managing your health, and finally, breathing easier.